Child CPR. Children have breathing difficulties more often than they have actual heart problems.
Therefore, it is important to begin CPR quickly and perform 5 sets of CPR for 1 rescuer or 10 sets of CPR for 2 rescuers before getting additional help. 1 set of CPR for 1 rescuer consists of 30 compressions and 2 breaths, and 1 set of CPR for 2 rescuers consists of 15 compressions and 2 breaths. If someone else is available, send them to call 911 EMS and find an AED. When they return, have them follow the AED prompts, apply AED pads, and help with CPR. If the child is unresponsive and not breathing or only gasping for air, provide CPR.
When giving CPR to a child, do the following. Make sure the scene and area around the child are safe. Tap the child and talk loudly. "Are you okay?" Yell for help. Check breathing. If the patient is not responding, not breathing, or only gasping, give 2 minutes of CPR or 5 sets of 30 compressions, 10 sets of 15 compressions for 2 rescuers. Call 911 EMS and get an AED. Resume CPR and give compressions and breaths. Child CPR, 1 year to puberty. CPR in children is very similar to CPR in adults. The main goals are early administration of CPR, pushing hard and fast on the chest, and giving breaths. Individuals older than 1 year of age who have not yet reached puberty are considered children. Some children appear adult size and can be treated as adults for the purposes of CPR. The term unresponsive, or not responding, includes any child who does not move, blink, speak, make a sound, or otherwise react to your efforts to awaken them. As a rescuer, if you are untrained in CPR, then give the hands-only CPR. The hands-only CPR is when you give continuous compressions but no breaths. If you can see a foreign object in the child's mouth and can easily remove it, do so. Avoid blindly sweeping the mouth with a finger, as it may push the object deeper into the airway. Watch and feel for breathing to begin. If the child does not respond or begin breathing, begin CPR and continue to provide it until additional help arrives. Large children may require chest thrusts if you cannot wrap your arms fully around the waist. In this case, perform the Heimlich maneuver with your fist on the breastbone. Any child who has had a severe choking event should see a doctor. If the child stops responding, lay them down and yell for help. Check for breathing and begin CPR. After 30 compressions, open the airway and look for a foreign object. If visible, remove it and attempt to give a breath. Continue CPR until the child recovers or more advanced help arrives.